On the ninth day of Christmas, my ER gave to me 9 vents alarming, 8 belly pains, 7 septic shocks, 6 stroke alerts, 5 pelvic rings, 4 pressors running, triple lumen cath, 2 trauma shears, and a CHF exacerbation. Let's talk about 2 really common vent alarms, high pressure alarm and low pressure alarm. And we're gonna use this hairdryer to help us understand the concept. Anytime you're getting a high pressure alarm, that's the vent telling you it's having to work way too hard and push too hard to be able to deliver that breath. So if you just think about it, you can probably walk yourself to whatever the problem is. Imagine I'm putting my hand right in front of the air dryer. Of course, it can't blow that air out because my hand is obstructing it. That was really hot. So what could be obstructing the vent circuit if it's trying to blow air into the patient's lungs? Well, anything that's in the way. It could be a mucus plug. It could be that somebody's standing on the vent circuit, or you've kinked it off when you loaded the patient into the helicopter or moved them in the emergency department over to the CT table. So run the circuit and make sure there's no kinks, and then suction your patient and make sure there isn't a blockage inside their endotracheal tube or in their large airways. Now, oppositely, we can have a low pressure alarm. That's the vent trying to tell you it's way too easy to deliver this breath. So there's not enough resistance that it's giving that the ventilator was used to on previous breaths. And a very common cause of that is your vent circuit has come disconnected from your endotracheal tube. It's super often in the transport environment because we're constantly moving the patient and bloop, that circuit comes off of that ET tube. We just plug it back in and we keep going. Another common cause is if we have ruptured the endotracheal tube cuff. And now that air, instead of going down into the lungs, is just escaping around that endotracheal tube, and it's just going into the patient's mouth instead of their lungs. Or worse yet, if we have dislodged the ET tube, which is another common problem that we see in the transport environment, is accidental dislodgements or extubations of the patient. So just think about the hairdryer and whether it's got a blockage in delivering the air or it's way too easy, and then you'll be able to figure out the problem with your patient.